Good morning. The first item of business is general questions, and at question number 1 I call Paul O'Kane.
To ask the Scottish Government whether it will provide an update on the development of the Changing Places Toilet Fund.
Minister Marie Todd.
I provided an update to Parliament on the Changing Places Toilet Fund during Jeremy Balfour's MSP's members' debate on the subject on the 11th of December. I also provided answers on the 6th of January to 5 written parliamentary questions submitted by Mr O'Kane on this issue. As I've said previously, I will provide a further update once arrangements have been finalised and subject to parliamentary approval of the Scottish Government's budget bill.
Paul O'Kane.
I thank the Minister for that answer and for her subsequent answers to which she refers. But when this funding was initially announced in 2021, the average cost of equipment for a Changing Places toilet ranged from between £12,000 to £17,000. That's according to PAMIS. And the Minister will be aware that significant rises in cost, particularly construction costs and the cost of equipment over many years, will have vastly increased the overall cost of building a Changing Places toilet. The Government has caused, I think, delays. There has been repeated reprofiling of the fund that has caused exasperation for disabled people, as the Minister well knows and has heard. And I think what's clear is that projects across the country have perhaps now cost more money and the fund has been devalued. So can I ask the Minister, has the Government done any analysis of how many projects she would expect £10 million to fund and how many fewer projects that might be as a result of the delays on this issue?
Minister.
I thank the member for the question. I would have to say we have done a great deal of work on Changing Places over a number of years, and I am absolutely delighted to have seen such progress in Scotland. The number of Changing Places as toilets in Scotland has risen from 25 to 269, meaning that Scotland has the highest number of Changing Places toilets per head in the UK. It's an increase of almost 30% compared to 2019, when the Scottish Government introduced the new Scottish Buildings Regulation. So it's not that we have made no progress without this funding. The member will be aware that we are operating in an extremely challenging financial context. We had to make difficult decisions collectively and flex to respond to changing circumstances. However, I was very pleased on the 11th of December to be able to confirm that work is ongoing to establish the number of projects that we have and how that fund will be distributed and how it will be profiled, and the funding will be in place next year. The Minister's support for this investment has been solid and steadfast. The best thing the member can do to ensure that that becomes a reality is to vote for the budget.
Brief supplementary, Bill Kidd.
Thank you very much, Presiding Officer. Changing Places toilets make a real difference to disabled people and their families, and we'd all like to see further provision. Can the Minister outline a wee bit more about how the Scottish Government will ensure the CPT fund is designed to meet the needs of those who need it most?
Minister.
I thank the member for the question, and I recognise the level of cross-party interest and cross-party support for Changing Places. During the debate on the 11th of December, members from every party, including Mr Kerr, Mr Macmillan, Paul O'Kane, all committed to seeing this happen. We're working very closely with PAMIS to develop the fund so that it takes account of user needs. PAMIS have significant technical expertise and experience of supporting local projects across Scotland. I updated the cross-party group on Changing Places toilets on the 14th of November, when I also sought initial views on the fund criteria. I'd like to continue that engagement and to learn lessons from similar funding schemes. We are able to learn a great deal from what has happened in England. It is clear that the fund will need to be flexible enough to take account of different local circumstances across Scotland.
Jeremy Balfour.
Thank you, President Officer. I wondered, could the Minister inform the Chamber what meetings she has had with third sector organisations other than PAMIS in the last 6 months regarding the setting up of Changing Places Fund?
Minister.
I'm afraid I don't have that information to hand. I can certainly write to the member and let him know what engagement the Government has had on the Changing Places Fund over the last 6 months.
Thank you. Question number 2, Jackie Dunbar.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update regarding the steps that it has taken to tackle child poverty.
Cabinet Secretary Shirley-Anne Somerville.
Eradicating child poverty remains the top priority for the Scottish Government. By the end of June, we will publish an annual progress report detailing action taken across 2024-25. The Scottish Budget for 25-26 outlines how we will continue to drive progress. This includes through continued investment in our Scottish Child Payment, early learning and childcare, and free bus travel, and the expansion of free school meals. We have also committed to spend £3 million to develop the systems to effectively scrap the impact of the two-child cap in 2026, which CPAG estimates could lift 15,000 children out of poverty.
Becky Dunbar.
I thank the Cabinet Secretary for that answer. It is clear that the Scottish Government is throwing the full weight of the Scottish Budget behind the priority mission to eradicate child poverty. But in spite of the remarkable work underway, it is also evident that under devolution, Scotland has one hand tied behind its back while Westminster's priorities lie elsewhere. Can the Cabinet Secretary outline how much of its devolved budget the Scottish Government anticipates it will have to commit to mitigating regressive UK Government policies in 25-26 in relation to tackling child poverty, despite Labour's promise of change?
Cabinet Secretary.
Well, I had difficulty hearing some of Jackie the Barr's supplementary due to, I think, a combination of laughter and groans from the Labour benches on this. So let me explain the details within the Scottish Government budget. That under devolution, Richard Leonard, we plan to spend over £210 million mitigating aggressive UK Labour government policies, an increase of £56 million since the Conservatives were in power. We are continuing to invest in the Scottish Welfare Fund and committing over £99 million for discretionary housing payments, mitigating the bedroom tax and the benefit cap. And despite Labour's promise of change, they have delivered deeper austerity, so this government will go further, will mitigate against the UK Labour government's winter fuel payment cut, and will also deliver the systems to mitigate against the Labour two-child cap.
Question number 3, Neil Bibby.
To ask the Scottish Government what estimate it has made of the number of children and young people leaving school unable to swim.
Minister Marie Todd.
The Scottish Government believes that every child should be given the opportunity to learn to swim. It's a life skill that can save lives. Swimming lessons are not delivered nationally as part of the school curriculum, and there's currently no requirement to report a child's swimming ability either locally or nationally. As a result, we are unable to provide an estimate of the number of pupils leaving school unable to swim. However, we'll continue to work with Sport Scotland, Scottish Swimming and various local and national partners to develop interventions and approaches to provide opportunities for children to become confident, safer and competent swimmers.
Neil Bibby.
Community access to swimming has been massively reduced through pool closures and opening hours being cut. Costs are also rising for families. Not every school has a pool, and it's getting harder to go swimming out with school. We know previously from Scottish Swimming that some time ago up to 40% of primary school-aged children left school unable to swim. That should be a serious concern for us all, including the Scottish Government. Scottish Swimming have a petition through the Parliament next week concerning the proposed closure of school pools, including 5 in Dundee. Does the Minister accept that all of this makes it more difficult to ensure primary school-aged children have the opportunity to learn how to swim and the basics of water safety? And what's the Government's plan to make sure that they can?
Minister.
So I absolutely recognise the challenges that the member describes, and I'll remind the Chamber that I live in the Highlands, where children are very often attending school a very long distance from their local pool. But in fact, Highland Council are dedicated to ensuring that children can learn to swim at school. The member asked about leisure facilities, and we understand the challenging financial circumstances that local authorities are currently facing in maintaining and operating sports and leisure facilities. In part, that is due to rising energy costs. We've repeatedly called on the UK Government to use all of the powers at its disposal to tackle that cost of living crisis and to provide appropriate energy bill relief to leisure facilities. Swimming is a very energy-dense activity. It's vital that all avenues are explored to ensure that where possible local clubs and communities have access to sport and leisure facilities. Myself and my colleague, the Cabinet Secretary for Education, will continue to work on a cross-portfolio basis to ensure that we maximise the opportunity for children to learn to swim at school.
Brief supplementary, Brian Whittle.
Thank you, Presiding Officer. Presiding Officer, swimming is a life skill. It is a safety issue. It is a positive health activity at a time when children's physical and mental health is worse than it's ever been. It's an activity where if you can't swim, you are excluded from participation, exacerbating inequalities. As I've continually said, we need to be increasing opportunities to be active. All primary schools should have access to free swimming lessons. Why does the Scottish Government keep digging their heels in? Surely they must be running out of excuses by now.
Brief response, Minister, please.
So there's much. Brian Whittle and I are very aligned on the issues around the value of sport and exercise for both your physical health and your mental health. And I think he alluded to the opportunities that arise from swimming for children with disabilities to be included. It really is a it's a superb sport for people to get involved in, and that's why the government is so committed to ensuring that opportunities are available for children in schools. As I said, we'll continue to work with Sport Scotland, with Scottish Swimming, and on a cross-portfolio basis across government in order to, and with local authorities, in order to ensure that we maximise that opportunity.
To number 4, Audrey Nicholl.
Thank you, Presiding Officer. To ask the Scottish Government how its draft budget will support the delivery of drug and alcohol services across Scotland.
Cabinet Secretary Neil Gray.
Thank you, Presiding Officer. The total funding proposed for alcohol and drugs, including Health Board baseline funding, is over £150 million in 25-26. This includes maintaining £112 million funding for alcohol and drug partnerships, continuing to fund grassroots organisations through £13 million via the Cora Foundation, and supporting a wide range of activity, including supporting residential rehabilitation and making £2.3 million available to support the Thistle Centre, the Safer Drug Consumption Facility. This adds to our significant investment over the past 4 years, meaning that I'm confident we will meet the National Mission commitment of £250 million additional funding over 5 years.
Audrey Nicholl.
I thank the Cabinet Secretary for his response. During recent engagement with GP practices, tackling alcohol harm was raised as an unrelenting health challenge. They expressed strong support for MUP and other measures to tackle alcohol harm. However, they also expressed some concern about a potential shift in the balance away from tackling alcohol harm, a point highlighted in the recent Audit Scotland review of alcohol and drug services. And this is not to diminish the urgency of the work to reduce drug harm. So in addition to previously announced efforts such as a review of the evidence in alcohol marketing, increasing MUP and developing a service specification for alcohol and drug services, what assurance can the Cabinet Secretary give that the draft Scottish budget will support the action necessary to reduce the level of alcohol, health and social harms and reduce the number of people who die as a result of alcohol?
Cabinet Secretary.
Thank you, President Officer. I thank Audrey Nicholl, and I want to give her, Parliament and other colleagues the reassurance that we remain committed and focused on tackling both issues. We remain committed to tackling alcohol-related harm on an equal footing to that of drugs. Our forecast spend in 25-26 of over £150 million is for both alcohol and drugs, and our substantial investment supports services which are often delivered in tandem at the front line. And in addition, national mission initiatives have made improvements in alcohol treatment as well as drugs. For example, our substantial investment in residential rehabilitation is benefiting people with both alcohol and drug dependency. Moreover, the forthcoming alcohol treatment guidelines will provide support for alcohol treatment similar to the medication-assisted treatment standard for drugs.
Brief supplementary, Carol Mockin.
Thank you, Presiding Officer. I also want to mention the Audit Scotland report published towards the end of last year. The findings in the report state that the Government's increased focus on drug harm through its National Mission programme is shifting the balance of attention from an effort on tackling alcohol harm. The Government itself has said this as a twin public health emergency, and we accept that. But sometimes the Government tends to list a semi-completed list of disjointed actions relating to alcohol harm prevention. We need clearer, more urgency in this. So can I ask the Cabinet Secretary if the Scottish Government in its 25-26 budget is considering ring-fencing funding for improving access to alcohol treatment services?
Cabinet Secretary.
We'll continue to work with alcohol and drug partnerships on making sure that the services are available as Carol Mockin asks for in a way that ensures there is support available for both. We're also taking action this year around the work with Public Health Scotland to provide an evidence-based picture on what further preventative actions we can take around alcohol advertising, and we'll consider the report as it comes back from Public Health Scotland around what further measures we can take on a preventative basis in that space. So I think around the interventions we're taking with alcohol and drug partnerships, the work that we're doing on minimum unit pricing, the work that we're doing to reduce the impact that alcohol advertising has, we're taking as many steps as possible. And if there is further work that Carol Mochan would wish to suggest, of course I'm more than happy to engage with her on that basis.
Question number 5, Colin Smith.
Thank you, President Officer. To ask the Scottish Government when it last discussed plans to reduce delayed discharge with NHS Dumfries and Galloway.
Cabinet Secretary Neil Gray.
Thank you, President Officer. The Collaborative Response and Assurance Group I chair jointly with COSLA has met weekly with leaders from across the health and social care system, including Dumfries and Galloway, since last June, with our most recent meeting on Monday. We have been working to support areas with high levels of delay, including Dumfries and Galloway, to understand their challenges and support them to deliver the changes that will improve people's journey from hospital to home or the care setting that is right for them. Our planned budget for 25-26 will invest a further £200 million to reduce waiting list backlogs, improve capacity and remove barriers which keep some patients in hospital longer than necessary.
Colin Smith.
A decade ago, the Scottish Government promised to eradicate delayed discharge, and since then, 193,000 bed days have been lost to delayed discharge at NHS Dumfries and Galloway, and the latest figures show that those numbers are rising yet again. No wonder the RCN today published devastating testimony of nurses having to care for patients on trolleys because there are no spare hospital beds. So, Cabinet Secretary, when will the Government finally deliver on its promise to eradicate delayed discharge, or is it just another SNP broken health promise?
Cabinet Secretary.
Thank you, President Officer. There are two elements here that I wish to address. The first is the intervention that we're seeking to take within the budget, which is directly to deliver against addressing the issues that we're facing with scheduled care and waiting lists, and also to address the flow through the system, providing capacity within social care as well as primary care to reduce hospital occupancy and reduce lengths of stay. Where we have worked with local systems, both on a health service basis and on a social care basis, to reduce length of stay and hospital occupancy, to reduce the level and to address pre-delay discharge from hospital, it has been successful. And that's the basis on which we will continue to intervene, and would encourage Colin Smith to support the finance being provided to ensure that can happen through the budget interventions. Of course, I regret the situation that has been raised with the Royal College of Nursing's report this morning. I addressed that in Good Morning Scotland this morning. It is a situation that we obviously wish to avoid, not just for patients, but also for staff, to ensure that we have a system that meets both of their needs.
Question number 6, Kenneth Gibson.
Thank you, Presiding Officer. To ask the Scottish Government what its position is on farmers giving the methane-reducing feed additive Bovar to their cattle.
Minister Jim Fairley.
Thank you, Presiding Officer. Bovaer is a methane-suppressing feed product which has undergone a safety assessment by Food Standards Agency and Food Standards Scotland safety assessment as a feed additive for all ruminants for milk production and reproduction. Bovaer was authorised for use in Scotland in December 2023. Parallel regulations authorise Bovaer across GB, and that approval means that farmers in Scotland can use Bovaer if they choose to do so.
Kenneth Gibson.
I thank the Minister for that answer. As he is aware, Bovar is manufactured at DSM's plant near my Dalry constituency office. Despite more than 58 studies on the product and it being evaluated as completely safe to use, Bovar has been the focus of significant online misinformation. Studies also show no safety concerns for workers handling the additive. Does the Minister agree that science, not social media, should govern our approach to food safety, and that Bovar, now routinely used across Europe, Australia and North America, has an important role in combating climate change?
Minister.
Thank you, President. I do agree with the understanding of our climate change. Kenneth Gibson makes a very important point. Social media has been great for a lot of different things, but occasionally it does throw up this kind of misinformation which overtakes the reality of the conversations that we need to have around the reasoned discussions and measures that we're going to take in order to be able to tackle the challenges we face. And research suggests that the appropriate use of methane-suppressing foods, or MSFPs, like Bovaer in livestock diets, more generally have an important role in helping us to reduce the emissions from livestock production.
Thank you, Minister. I regret that we will not be able to take any further questions in this session, and I would just remind members of the expectations regarding length of questions and responses, because more concise questions and responses enable more members to participate in each session. That concludes general questions.